Now I want to look at two conditions. I think one is the one that affects what? The bones, while the other one affects the synovium. Okay, so this is what is known as what? The Osteochondritis Dissecans and Synovial Chondromatosis. So let's discuss these two conditions and get to look at, what they mean. So just so you know, all of them, they are joint disorders, So let's quickly just look at them individually. So for the osteochondritis dissecans, so that is an idiopathic disease of the subchondral bone and usually leads to the separation of the bone and the overlying cartilage. Do you understand? Like, see, the cartilage that is on the bone is getting separated. You get it? So it leads to impaired blood flow. So there's loss of blood supply leading to necrosis of the subchondral bone. There's now instability of the cartilage, and fragments may detach into joint space. Okay, they usually occur on the knee, on the elbow, the ankle. So there's lots of joint pains, there's swellings, there's stiffness. Usually affects adolescents and young adults. Okay, you diagnose it using X-rays and MRI. So treatment is, the lesion is stable, the person just have to rest more, reduce any activity that will stress that part of the body. Then if it is unstable, all the surgical fixations, drillings, removal of the loose fragments, and the rest of it. So how about the synovial chondromatosis? See, it's kind of like a tumor growth in the synovium. Okay, so it's just benign metaplastic disorder of the synovium. This is where the synovial cells transform into cartilage producing cells. So most of the times the tumor comes in and it can even detach, fall into the joint, and they become all those loose bodies in the joint, causing a lot of pain and the rest of it. So you have a lot of pain and swelling, and there's reduced range of motion and mechanical symptoms like locking and clicking sensations. So usually affects adults that are between 30 to 50 years. You diagnose it using X-rays, MRIs, and CT scans. You manage it by what? Just cutting out the synovium, okay, that's synovectomy, removal of the loose bodies, and I think that's it for this.